So I was born and raised in Korea, and my family moved to the United States when I was in 4th grade. And coming in, I always had like really good memories of going to my pediatrician when I was little. And moving to the States, we didn't really have health insurance growing up. It wasn't just something that we cared to buy at that time. And my mom had these really bad migraines that would affect her really significantly. And to me, you know, my mom was a superwoman, like working 6 days a week, always being able to put meals on our table, doing all the household chores, and I just never understood why all these migraines were hurting her so bad, but she would never go see a doctor. And I just thought, you know, if you go see a doctor is someone that's going to make you feel better no matter what if you're sick. And as I got older, you know, I started realizing it's not just about, for her, it wasn't just like the financial barriers, but it was like the cultural barriers, like not being able to speak English to a physician, you know, thinking about what's going to happen, not having health insurance and everything like that. And that just made me want to become a doctor so that I could be, you know, that sort of like the cultural, you know, the change in the culture and being able to understand my patients from that perspective. Being able to serve, you know, in the low-income communities, the underserved communities, I find it very rewarding because everybody is very thankful for the work that we're doing, and it's definitely a population that is very high in need. A patient that I always remember was in my 2nd year when I hadn't actually entered into the clinical years yet. I was at my preceptor, and it was at this low-income clinic called Crossover Clinic in Richmond. And at Crossover Clinic, we help a lot of Hispanic-speaking populations. And this patient that I was seeing, she was supposed to be just like a regular follow-up, looking at her lab results and telling her like everything looked normal. And it was me, I was working with a pharmacy student as well as a translator because I'm not fluent in Spanish. And I just talked to her, told her lab results looked good, and asked her if there was anything else going on in her life. And she just told us, you know, I've been dealing with anxiety, and she sort of went on to talk about what was going on in her family and how that was a really big stressor for her. And that really left a big mark on me because with all these people in the room, me being a medical student and also having a translator and having that language barrier, somehow she felt comfortable enough to talk to me about the stressors that she was having at home. And I think as physicians, you become very humble because your patients just kind of bring all this out to you, all of their not just medical issues, but also mental health issues too, and all of their worries and concerns. It's just something that always brings you back to why you went into medicine in the first place. It's really easy to get caught up in how stressful it is studying from books all the time, but volunteering is something that brings you back to your primary motivation on why you decided to become a doctor, and it's very rewarding.